It is such an honor. We are here at the Prime Health Summit with one of the founders of Prime Health,
Sir.
Jake Rishavy, and also the VP of Innovations at Denver South.
That's right.
So why don't we start with you? You know, what's your personal passion? What's your personal mission? What drives you?
Particularly in this healthcare space, I believe in the power of community. I mean, when you're talking about big entrenched systems with deeply impactful problems for individuals, that's what motivates me. I mean, I think being a change agent in healthcare is about improving the quality of lives at the end of the day, and we may do that in many different ways. It might be starting a company that addresses a need for a healthcare system that's making a dent in that system, or maybe it's, in the case of Prime Health, it's building a community to create that leverage with the kind of entrenched players in the kind of traditional healthcare system to bring about the type of change that you're trying to see. And I think that's, to me, motivating the power of collaboration and community to impact, to create a positive impact. That, to me, if that doesn't get you going, I mean, I don't know what would.
You know, there's been so much evolution. There seems like there's a great energy here now, and I know that's been built up over years. Maybe walk us through that journey and what it's like now. What's going on here in Colorado?
Yeah, well, I mean, Colorado is, I believe, a unique place. I've done business around the country and a good bit internationally, and I have never been a part of a community like this where collaboration, I mean, a lot of people pay lip service to collaboration, but we experience it on the ground here every day. You've got folks who are direct competitors, you know, even within this kind of broad topic of digital health or health technology or health innovation. You know, you've got maybe two telehealth companies that logically should be competitors that are actively participating in the same programs, sharing best practices, sharing resources in some cases to help each other succeed, because we know that the benefit of working together is that we're going to become greater than the sum of our parts. And I mean, I think that's playing out here. It is part of the Colorado DNA and really has been, I think, but largely because 5/6 of the population of Colorado was born outside the state. And so I think the fact that everybody's coming in.
People are moving in droves here.
I know.
Entrepreneurs, investors, tech innovation, everything's happening.
And one of the top locations for relocating millennial workforce, creative class workforce in the country for the last 4 years running. So I mean, that bodes well for the future of Colorado, and particularly in the context of innovation in healthcare.
So you're also involved in the Smart Cities initiative that you're leading. What is that, and what's the goal there?
So the Denver South Economic Development Partnership represents 3 cities and 2 counties in South Denver, basically a stretch of I-25, say a 8-mile by 4-mile stretch of the highway. Small in geography, but home to 7 of the 10 Fortune 500 companies in Colorado, 20,000 other companies, 250,000 workers, and about 20% of the state's economic output. Those cities, while they're suburban in nature, are experiencing the same type of urban challenges that downtown Denver is in many cases. And health is critical. You know, you can't have a smart city without addressing population health, and population health in a sense of a geographic population, not necessarily just the population of a certain healthcare system. And so what we're working with on behalf of our 3 cities and 2 counties is to provide a mechanism for them to source and vet and qualify promising smart cities technologies in a whole host of areas, things like transportation and mobility, public safety and security, population health, energy and resource efficiency, and helping them to engage in public-private partnerships to solve some of those problems. And that's, it's not all that dissimilar to what Prime Health does for health systems. We go out and do the discovery work to identify the problem areas, the pain points that those large systems are experiencing, and then employ this methodology to identify the most promising solutions. We're now doing that on behalf of our cities and counties in that Smart Cities umbrella.
So Startup Health is new here and very honored to be welcomed into the ecosystem here. What advice do you have for Startup Health? What can Startup Health do to really be most supportive to what's going on here, really add energy and fuel to the fire here?
Well, you all have, first and foremost, a tremendous reputation as being collaborative players, long before you're ever being on the ground here. I think people have a lot of respect in this community for Startup Health and what you all stand for. And so I think that making that available and just showing folks that that is part of your DNA too, I think is only going to be inspiring for the entrepreneurial ecosystem here. And then on a more tactical level, you all have built a wonderful international network that could be very valuable to Colorado and the ecosystem of companies here. I mean, we've done a lot of work to create connectivity to customers and capital on the coasts and internationally, but there's only so much you can do, and I think that a big part of the power of your presence here in this network is helping the companies here to access that network, and then in return, I think Prime Health is eager to partner with Startup Health to make sure that you have the ability to quickly integrate into the community here as well.
Yeah, there's so much we can do together. Yeah. And what lessons learned, maybe advice or wisdom to share with entrepreneurs, health transformers that are thinking of coming here, maybe working on some of the smart cities? What should they know?
Well, I think to very simply put it, understand the problem before you get too far down the road. I mean, if you've got, we preach to the companies that are already here that you should start out with a clearly defined problem that is being experienced by a clearly defined customer before you ever get out of the gates. And it's that lean startup methodology. It's
get out there with the customer, with the people,
instantly. And so, and whether that's digital health or IoT or smart cities, that truth holds. And so we encourage people to do their homework and that's part of the value that we provide in creating that connectivity between the entrepreneurial ecosystem and the established healthcare industry here in Colorado is for that information sharing to take place. And so I think that's, for a company that might be outside of Colorado, looking at Colorado as a potential expansion or relocation area, we really pride ourselves in being able to allow those companies to hit the ground here and as quickly as anywhere else, connect with all the resources that you need in the community that exists out there.
What do you do to stay healthy?
So I'm a fly fisherman, and my wife.
That's why you ended up here. Right?
It is. That's what brought me to Colorado to begin with. My wife and I and our little daughter. We have an 18-month-old daughter.
Congratulations.
Thank you very much. That's a wild ride in and of itself, but we get out of town as much as we can. I mean, Colorado is obviously blessed with world-class recreation amenities. Some of the best fly fishing in the world is an hour or two outside of town.
So it's almost like meditating.
It is.
Yeah.
It is. Being out there on the river and not seeing another person, especially when you're in the line of work that we are, where you
set your phone down, maybe set it across the
I turn it off, throw it in a dry bag and tuck it away for the day for sure.
Good. Yeah. Good. Yeah. Well, thank you for everything that you do and for being so welcoming to Startup Health. It's great to be here.
Well, we are thrilled to have you here, so thank you.
Excellent.